One of the other questions that I get asked is which manufacturer or what implant should we use? And in the United States, there are 3 manufacturers available to us. The first is Allergan. They make Botox, they make Latisse, Juvederm. So that's a company that you're probably familiar with. I've used many of their saline implants when they were known as McGann, but I really haven't used their gel implant, so I'm not going to comment on their implants at all. The second company is called Mentor, and they're owned by Johnson & Johnson, and they're a very good company. They have saline implants, and they also have gel implants. Now their gel implants come in round, and they have different profiles or projections of implants. This is a moderate plus, and this is a high, and now they even have an ultra high profile implant. And the advantage of the moderate implant being a bit wider and not as tall is that from the clavicle, the collarbone, to the nipple, it's going to give you more of a straighter line and tend to look a little bit more natural. The higher profile implants, on the other hand, are narrower and they're taller. So in that same footprint, I can give you a lot more volume. So a lady that's looking to be as large as possible, we may have to go to a higher profile implant. The disadvantage of the high profile implant is that from the clavicle to the nipple again, it's going to start to bump out a little bit more aggressively, and you might start to see the edge of the implant a little bit more readily. So you may not be as natural in appearance with a higher profile implant as you might with a lower profile implant. The third company is called Sientra, and while I've used more Mentor implants in my career, I've used the Sientras for a longer period of time. I was one of the co-investigators in the study that helped them get their FDA approval, so I've been using their implants since approximately 2002. They have, in addition to round implants, a shaped implant, and they call this an anatomical implant, and they come in different variations of the theme, but basically the idea is that instead of a round appearance, they will try to give more of a natural appearance to them. They have different profiles of the same idea, different sizes in the same idea, but this is another alternative. One last thing that I try to explain to folks is the differences between the shell. This particular implant is a textured implant, meaning that it has little indentations, little nooks and crannies, so that the tissue can grow into these little indentations and hold the implant into place. That's what keeps it from turning and spinning. And the other advantage of a textured is that over time it tends to hold its position better so that it doesn't drop down and out over time based on muscle activity, etc. So my practice, we're using more of the textured implants than the smooth implant. The smooth implant is what most American surgeons are using. In Europe, they're using more and more of the textured implant. And I think in the United States, 5 years, 10 years from now, this is what we'll see the predominance of.